Welcome to iPEMS, a podcast series that teaches about pediatric emergency medication safety and equips providers with strategies for solutions. I'm your host, Dr. Tiffani Johnson of the Emergency Medical Services for Children National Resource Center. In other episodes in the iPEMS series, we focused on identifying the problem and the challenges with safely delivering medications to children in the emergency medical setting. We've also discussed some different methods for starting a QI project at your institution. We realize that a lot of times it's very easy to identify problems, but sometimes more challenging to come up with solutions. Joining us today is Dr. Jane Knapp of Children's Mercy Hospital. Today she will be reviewing an activity called Fresh Eyes, which can be used to come up with some testable changes in your institution. Dr. Knapp, can you start off by telling us what Fresh Eyes is and giving us an overview of the activity?
What you do with Fresh Eyes is you find a problem statement. So if we're talking about patient and family-centered care, you might pick one related to medication safety. So you pick a problem statement. How do we make medication safety more prominent, or how do we teach medication safety in a pediatric emergency department? Then you might look at that statement and you try to reframe it, and you try to put it in very simple terms. So you might get rid of the word medication, and you might include the patient in the family's role. So once you reframe your statement, then the group will talk about some of the rules, and the rules are: be creative, be wild. Only one person talks at a time. No idea is off limits. And as you go from learning the rules of the exercise, everybody picks a perspective, and the perspectives come from a sheet that include maybe 30 or 40 different perspectives, anything from the hotel industry, for instance, to fast food industry, to Hollywood, maybe even from the perspective of an animal, like an insect. Then, once you pick your perspective, you start to think of the reframed problem from the point of view of, say, a Hollywood producer. And you just let the ideas flow. And as they flow, you're talking about approaches that a Hollywood producer might take to medication safety. And then you try to translate those into what you might do in an emergency department. So would you make a little video for the waiting room about medication safety for parents? Or would you do one for teens? Or would you do one for school-age kids? And by using those ideas, you get to a project that you think is testable, that's doable, that could be easily tried by a resident or a group of residents during their residency program.
And can you provide us with an example of how to use this Fresh Eyes approach when trying to identify solutions for safely delivering medications to children in the emergency medical setting?
So let's take an example from a group that I've already seen take medication safety and look at it from not just the standpoint of medication errors, but the standpoint of delivering the right drug to the right patient at the right time, and take the example of the relief of pain and anxiety, which comes up all the time in children in an emergency setting. So the group that I saw do it picked the role of a NASCAR driver. And they started to think about NASCAR as a team approach, that if a car breaks down, for instance, the driver is relying on their team, their pit crew, to get them back on the racetrack in a timely manner, to do it safely so that the car doesn't crash because somebody made an error in repairing the car, and to work as a team to do it. Another thing that they thought about is that the NASCAR driver is relying on the gauges in their automobile to tell them how fast they're going, how much fuel do they have left, other things about the performance of the motor car. So if we took just those two concepts, as the team I saw use them did, we can say that, okay, in the emergency department, we're going to be using a team approach. We're going to have the nurse nurse involved, maybe the pharmacist involved. We're going to have the family members and even the patient involved in terms of trying to pick the medication that's best for the pain that child's having, maybe based on the experiences that they've had in the past, and to do it in a timely manner so that our team is ready to order that dose and get it to the child for the relief of their pain as quickly as possible. And then thinking about the gauges and the measures approach that you might see on the dashboard of a racing car, what we'll want to use is in medicine is maybe pain scales to help us gauge how we're doing in the relief of that child's pain. Another way that we might use that approach as the team and engaging how the child is doing is bring child life into the picture as members of the healthcare team, and they'll use techniques like a race car driver might use of distraction to help the patient and the family through the painful procedure also. So you can see once you start to adopt another point of view, think as a race car or a racing team might think, you can change your perspective and look for solutions that we might not always think of in medicine. And it makes it creative, it makes it fun, and many times it gives you a very testable solution.
Well, thank you so much for joining us today, Dr. Knapp, and sharing with us a very creative way for identifying some solutions to the problems that we encounter when trying to safely deliver medication to children in the emergency medical setting. And thank you for listening to this episode of iPEMS. To learn more about pediatric emergency medication safety and strategies for solutions, please tune into other episodes in the iPEMS series.